Hey everyone, welcome to Food Talk Live. A reminder that this episode will also appear on our podcast, Food Talk with Danny Nierenberg. So please subscribe, rate, and review wherever you listen to podcasts. It really means the world to me if you do that. Today I'm really excited because I get to talk to Dr. Darius Mozaffarian, a cardiologist and the dean of the Tufts Friedman School of Nutrition Science and Policy, as well as a professor in both the Friedman School and the Tufts Medical School. He is widely respected and cited all over on nutrition, cardiovascular disease. He's a leader in the food as medicine movement, and a co-chair of last year's 50th anniversary conference to follow up on the White House Conference on Food, Nutrition, and Health in 1969. He's also been a very great mentor to me and friend to Food Tank, and we've been honored to hold events at the Friedman School where I graduated from a million years ago. So, Darius, so great to see you. I wish it could be in person. Thanks so much for joining us.
Oh, of course. It's so wonderful always to speak with you, Danny. You're one of our wonderful alums who does incredible social entrepreneurship and public impact and is really making a difference in the world. So we're really proud to have you as one of our alumni.
Well, I couldn't have done it without the Friedman School, and that is the truth. So thank you. So I want to dive right in. You know, COVID-19 is having devastating impacts all over the world. But there's a lot of nutrition and food and how we grow and produce food. And I know in March you co-authored a piece for CNN entitled "How Your Diet Can Flatten the Curve." And I talked a little bit to former Secretary of Agriculture Dan Glickman about the policy perspective at that work. But I'm wondering if you could dive in a little bit more to the ways food influences our immune system. What are those links?
Yeah, it's really incredible with COVID-19 how many interlinkages there are with food in our food system. Some of them obvious, but some of them not so obvious. And
right.
So, among those, the obvious ones are obviously the disruption to supply chains, the enormous food insecurity with people out of jobs and kids out of school. I mean, those things are massive, but there's many, many others. And so, specific nutrients in foods could really improve the immune response to COVID, and we can talk about that more. More science is needed, but clearly there's some foods and nutrients that should be being looked at. We know also generally just being malnourished is a risk factor for a poor immune response, and so for sure just being malnourished is going to worsen COVID. And so those are two very, very direct ways by being sure people are at least minimally nourished, but also really specific nutrients that could help. The other big issue, which is really not being emphasized, is the severity of COVID illness is linked to basically major diet-related diseases: obesity, diabetes, hypertension, heart disease in particular. From an analysis in New York and analyses in China and Italy, around the country, elsewhere around the world, people who have diabetes or high blood pressure or obesity have much higher risk of severe illness, and that should be addressed right away. And again, happy to talk about that as well. And so this combination of kind of disrupted production and supply chains, poor access to food or ability to afford food because of loss of schools and restaurants and loss of jobs and wages, and then these additional issues around immunity and also diet-related chronic diseases. All of these things are intersecting around COVID, and I think food and nutrition are as important as they've ever been.
Oh yeah, absolutely. So you talked about some specific nutrients that could really help, strengthen our immune systems to COVID-19 and probably lots of other viruses and illnesses as well. Can you talk about what some of those are?
Yeah, well, there's no nutrients that have been directly tested against COVID yet. And actually at Tufts, we're designing a trial and aiming to actually design a trial and get secure funding from foundations or potentially the federal government to do a big trial. The science is not definitive, and so we really do need to test these nutrients. But there's a range of vitamins, there's a range of flavonols, there's a range of minerals that have been looked at that we know, on the one hand, improve the immune system function, in particular T cell responses to other viral infections. A second key component is that several specific nutrients seem to have activity against COVID-19 specific proteins. And we know that from studies with the SARS coronavirus, which was, has a lot of similarities, and a lot of the proteins are very, very similar. And we know from studies and experiments that those nutrients are important. And then thirdly, what's really interesting, beyond the kind of general immune boosting effects, the COVID specific protein effects, many of these same nutrients or other nutrients also kind of blunt or soften this excessive inflammatory response. That's really what's causing deaths in COVID. Mm-hmm. In the flu, with influenza, what often causes death is bacterial infection on top of the virus. People get the virus, the influenza, then they get a bacterial infection and they get sick. With COVID, what seems to lead to hospitalization, need for a ventilator, and death is an excessive, overwhelming inflammatory response that leads to kind of what's called cytokine storm. Mm-hmm. And many of these nutrients actually seem to blunt that. So the combination of all three of those things, boosting T cell function and other immune function, specific activity against COVID-19, and also this kind of blunted, excess inflammatory response, could really be powerful. And certainly the evidence is not perfect, and we need trials. But I see, and I'm looking at dozens and dozens of studies being funded on chloroquine and hydroxychloroquine and remdesivir and other drugs, and the evidence for these agents is at least as strong, if not actually stronger, with much more attractive safety profiles. So we absolutely should be putting these at the top of their list. And there's a long list of nutrients. Again, we're coming up with kind of a specific combination, which I hope to be able to tell you about when we hopefully get funding. We can give you more details. But some of the foods, I wrote down some of the foods that I think people should be focusing on as they can, that are rich in these vitamins and minerals. Nuts, almonds, hazelnuts in particular, all kinds of berries, citrus fruits, among vegetables, mushrooms, sweet potatoes, red bell peppers, shellfish are rich in many of these nutrients, beans, and then, interesting, not conclusive, but some kinds of tea, turmeric, others. And so I think that it's too early to be telling people, go get this supplement and take this nutrient now to prevent COVID, but we absolutely should be testing these in trials.
Absolutely. And, it's kind of just a matter of eating the rainbow for your general overall health. These are all foods that are going to keep you probably healthy no matter what happens, no matter if there's a pandemic or not. You mentioned that there's a lack of evidence or concrete evidence, and there's lots of sort of anecdotal information. And you're working on trials. I'm sure other major universities are as well, and other research groups. And I asked Secretary Glickman a little bit about this, but it's surprising to me, and perhaps I shouldn't be surprised. I'm not that naive, but why hasn't there been more research into the links between nutrition and health, and real food as medicine kind of research?
Yeah, well, I think COVID-19 is highlighting, three big issues. One is that we have not invested in the science that we should have invested in up until this point to have the answers to these questions, right? Shouldn't we have spent a significant amount of money, several billions of dollars a year, studying nutrition and these questions, so that when we get hit with the pandemic, we actually have the answers, and we say, oh, we have all this information, here you go, right? People are talking about stocking personal protective equipment and stocking ventilators and stocking vaccines, but what about stocking science on food and health and nutrition, right? That would have been incredibly important. Second, I think that there's incredible fragmentation of the food supply, of our food policy, of our food research. COVID-19 has highlighted that more than ever before, how fragmented all of these investments are. The federal government, state governments are investing in many different aspects of the food system, and it's fragmented. And then I think third, that has been really highlighted, is that COVID is a very, very vicious pandemic, but we've had an equally vicious pandemic that's just been slower, of obesity and diabetes and other diet-related diseases. It's been slower, like instead of over a year, it's been over 30 or 40 years. It's not that slow. 30 or 40 years is really fast.
Right.
But because it's happened over 30 to 40 years, we've kind of ignored that equivalent or even larger pandemic. And now they're coming together, and we're seeing that we've sort of, set up an environment of people with poor metabolic health who are
Right.
predisposed to COVID. In many analyses, it seems that these risk factors like diabetes and obesity and hypertension are so important. If we had a healthier population, one could estimate that the great majority of hospitalizations would have been prevented. And so instead of shuttering our economy and spending trillions and trillions of dollars on necessary bailouts and other things, this would have been like a very, very bad flu season if we had a pretty metabolically healthy population. And so that's important because COVID's going to be with us for years. And we have to remember, this is actually the third pandemic that's hit the world. SARS and MERV in the Middle East just didn't hit the US, so we didn't pay attention to it, but this is really the third one. So more are coming. This isn't the only one. And so both to deal with this pandemic and future ones, we should be absolutely making it a priority to improve the population's metabolic health. And so I think those three things, and I hope we can talk more about each of them, some specific solutions. We need more science and public health. We need better coordination of our nearly $200 billion federal investments in food and nutrition policy, and we need to make it a major priority to fix the metabolic health of our country. If not now, when?
If not now, when is for sure. You talked about sort of this fragmentation, and people like you and I and many others have been talking about the need for breaking down silos in the food system I've been doing it for as long as I can remember. So do you think that this pandemic will help break down those silos or at least chip away at them a little bit?
Well, I think one analogy, which is interesting, is September 11th. So after September 11th, there was a recognition that the national intelligence was excellent, but fragmented. And so we were spending about $50 billion a year on national intelligence across the CIA and the FBI and many, many other organizations, and yet it was fragmented. And so Congress and the White House recognized this, and they created the Office of the Director of National Intelligence, the ODNI, to coordinate national intelligence at the highest level, report to the White House, report to Congress, report to the Joint Chiefs of Staff, report to the federal agencies. And it's been very successful. And so that, I think, recognition, we're seeing a similar recognition, I hope, of the fragmentation of food policy, from production to supply chains to health to science. And the federal investment in food is much, much greater than the federal investment in national intelligence, at least $150 billion a year across USDA, USAID, the CDC, the FDA, the EPA, and the Department of Defense, the VA. It's in almost every agency actually has food-related programs and policies. So that much larger fragmented set of investments, I think we need to coordinate that. And so I think that this is the time to call for a similar office like the ODNI for food, and it could be the Office of the National Director of Food and Nutrition, right? There should be an Office of a National Director of Food and Nutrition, a cabinet level office that brings together all of these incredibly important agencies that are doing great work. I'm not trying to criticize the agency's work, it's just fragmented. And that could be incredibly valuable and powerful. And I really think Congress should consider that the same way they recognize the need to do so for national intelligence after September 11th.
Absolutely. I love that idea, Office of National Food and Nutrition. I have many people I would recommend for that posting. That would be wonderful. I want to change gears a little bit and talk about, what we've been hearing on the news is that more people are cooking at home than ever. And, this could lead to folks having, not only a greater interest and awareness about where their food comes from, but also eating better. But I don't know if I'm buying that. And I'll tell you why for a couple of reasons. I feel like snack food sales have gone dramatically up during this time. People are investing a lot in sort of comfort foods. And so I'm interested in hearing what you think about this sort of, more folks are definitely eating more at home, but I'm not convinced that they're eating better at home than they were pre-pandemic.
Well, I'll tell you what we knew before this hit. So we knew before this hit that on average, Americans' diets are slowly improving over time. Very, very modest improvements. We're still a long way away from where we need to be, but they're slowly improving. Sure. But almost all of that improvement has happened in foods purchased at the grocery store and in schools. And so foods and restaurants, almost no improvement. And so certainly the shuttering of restaurants, while economically devastating for overall nutrition, that could be a positive if people went and cooked and purchased healthier foods and learn how to cook. But I totally agree with you that I'm concerned that we don't know. First of all, it's kind of shocking that we don't have real-time surveillance. Another reason for more research in public health infrastructure, and surveillance is one of the crucial things, right? To actually be able to survey what's happening to people's diets. I think there's probably going to be these two different camps, right? There's a camp of people who are going to be at home and getting, the worst possible pre-prepared foods and comfort foods and snack and junk foods because they just have no idea what to do in the kitchen. Sure. Or because of income and access. And then at the same time, there's going to be people who are, for the first time ever, actually saying, hey, I can actually sit and cook and assemble some reasonable things. So I think what's most concerning to me, most shocking to me, most upsetting to me, what keeps me up at night is we're not leveraging this moment to help shift that. We're just watching it happen rather than doing something about it. So if you think about how much time and effort and attention federal officials, major cities, public health experts are spending to talk about social distancing, about wearing masks, about hand washing.
Right.
Of course, the response hasn't been uniform, but there's been a huge change in behavior across the country overall because of this public health messaging. Why in the heck aren't we adding to that? You're at home, 330 million Americans are at home cooking. We know metabolic illness is the top single predictor outside age of having poor outcomes. If we want to bend the curve, if you want to be healthier, you should be eating more healthy, and to give specifics about what that means, because otherwise people get confused, but give some really clear specifics, and going out and exercising. Every single day, the government should be giving that message out, because we're sort of losing this incredible opportunity to get that message. If we even improve metabolic health in the United States 5%, this could be massive for COVID. And people think about obesity, and obesity does take time. I mean, months to a year to improve. But diabetes and hypertension, well done randomized controlled trials show that within 5 to 6 weeks of changing your diet, without exercise and without weight loss, you can substantially improve your blood pressure and your inflammation and your glucose and insulin values. Now, we don't know for sure whether that will immediately translate into lower risk of severe outcomes with COVID, but it should, and it's not going to hurt to have a healthier population. 5 to 6 weeks, right? And so this should be massive. And what's interesting, Danny, is that in the United Kingdom, because of Boris Johnson, the Prime Minister, getting so sick and being overweight and realizing that his being overweight put him in the ICU. This is on the front page of the United Kingdom newspapers. On the front page, Boris Johnson is talking about it. The United Kingdom is saying, okay, look, we have a metabolically unhealthy population. We can address this. By recent estimates, 88% of American adults are metabolically unhealthy. 88%. If you just look at waist circumference, glucose, blood pressure, and cholesterol. Just 4 things. 88% of Americans are metabolically unhealthy. We should rapidly try to improve that through just public health messaging to start. And then once we've done that, there's actually policies we should start to implement, which I know is something you're very interested in, is, what are policies to make it easier for people to be healthy? Because this isn't about just free will and personal choice. This is about having environments that help people make better choices.
Right, and that's especially concerning right now when you have so many people out of work, and then you have that on top of folks who are living in underserved communities of color who are disproportionately affected by COVID-19. The lack of open grocery stores, disruptions in the food supply chain that you talked about, which leaves many shelves bare. There's a lot going on here this idea that you mentioned of leveraging this moment. I don't think we're doing that in as creative ways we could. And I don't want to blame everything on the federal government or the administration. But when you look at what some cities and towns and, other municipalities are doing, that they're handling this in very different ways. And I think we have a lot to learn from some of those smaller governments at this point.
Yeah, and I don't know. I agree with you. It's not just up to the federal government to do this. mayors and governors should be doing this too. And I haven't heard this emphasized anywhere in the United States. So if you know of places that are doing this well, I know in our city, the mayor has kept the parks open, which I think is nice. That's good, and I think that's important. And told people to socially distance, but go out and exercise. But it hasn't been a daily message to go out and exercise, right? And we're probably one of the more progressive neighborhoods here in Massachusetts. So I think that this message around food being medicine and food being important for risk is really important.
I want to give you a chance to talk about before you have to leave, to talk about I know you and former Secretary Glickman work a lot together on these issues, and both the policy angle and nutrition and food angle. And last summer you wrote an op-ed entitled "Our Food is Killing Too Many of Us," and you called on every presidential candidate at that time to have a food platform. And I think now that's more important than ever, where, just a few months really now away from the election, and no one is talking about food. I mean, certainly the president isn't. I heard very little from the potential, who I assume will be the nominee, Joe Biden. If you were in the room with both of them right now, what would you tell them?
Well, I think that whoever wins, the national election, whatever the next administration is, food and nutrition and the whole food system is a massive opportunity. It's an opportunity. It's an opportunity to make our country healthier. It's an opportunity to reduce disparities, diet-related health disparities. It's an opportunity to preserve our natural resources, our soil, our forests, our oceans, our climate. It's an opportunity for, I think, most importantly, for the government to reduce healthcare costs. We have spiraling out of control healthcare costs, and we have a sick care system, and we need to shift that through making people healthier. I'm a cardiologist. I believe in our healthcare system. We have one of the best healthcare systems in the world for treating acute disease. We don't have a good system for preventing disease, and so we need to shift to prevention. And this is an enormous opportunity for economic development, for new businesses and jobs. There's billions of dollars going into innovation in the food system, lots of small startups, doing really innovative things. The government should be encouraging and incentivizing that for nutrition and equity and sustainability. And then lastly, this will reinvigorate our farms in our rural regions, the middle of the country, which produces all the food, where farmers are struggling very, very hard to make ends meet. And we need to be shifting and giving them tools to be able to make, healthier, equitable, sustainable foods. The world is going to demand foods that keep us nutritious, that are equitably, accessible and affordable, and that are sustainable for the earth. And if whatever country figures that out is going to be way ahead in their economic success and in their jobs. And so, energy was this 20, 30 years ago, this was about energy. Energy was the big, thing of the future. And I think this has been true. The countries that have figured out solar and batteries and wind are really doing well in that. And so we need to do this for food. And so if all of us, not just I think all of us need to be telling our policy leaders, our state policy leaders, our congressmen, our senators, and the candidates in both parties, that food is important to us. Food is important to health. Food is important to equity. Food is important to the economy. And there needs to be a food platform. And, what that food platform is, it needs to have all of those elements in it. Elements around how we can better leverage our investments in schools, how we can better leverage our investments in the federal feeding programs, how we can use business innovation and spur business innovation, how we can make the food environment a place where the default choice, the cheaper, easier choice is healthier. And all of that can be done. What's exciting, Danny, is 20 years ago, 10 years ago, I don't know that we had the policy science to answer these questions. And, it's not perfect, but we know a lot. And so we know if you leverage things that the federal government can do now, we can make a difference. And I'll just give you one example to not keep it at the 10,000 foot level. I'll give you one example is food as medicine in healthcare. So again, we know food is the single leading cause of poor health and the single leading opportunity for prevention. and yet nutrition's pretty much ignored in the healthcare system. And so there's several ways that we know should be tested at least to implement this. One is produce prescriptions, that you go to a doctor, you have a certain medical condition, and they give you a prescription to go get not just fruits and vegetables, but hopefully also nuts and beans and seafood and healthy oils and some whole grains. And you go get that prescription, and all or part of it is paid by your health insurance, the same way your health insurance pays for really expensive drugs or cancer chemotherapy or surgery. That's happening right now. That's being implemented in some private healthcare settings, and it's being actually tested with support by the Farm Bill in a very small way. That needs to be expanded. So that's just one example of the things that can be done. And so, there's no single solution. I can't just say, let's just tax soda and everything will be fixed, right? We're not going to have a single solution. Although taxing, junk foods could be one way to raise revenue to subsidize healthy foods. But we need an overall package. And you mentioned before, we did this 50th White House conference 50 years ago, now more than 50 years ago, 1969, the federal government, for the first time in its history and the last time, took a big picture look at food and said, how is food affecting their country and what should we do? The focus in 1969 was on severe caloric, insufficiency, severe hunger where kids didn't have calories. And it was a huge problem in the 60s. And there were massive positive impacts of that 1969 conference, which was organized by Dr. Jean Mayer, who went on to found our school. And that conference had many, many things that it changed. It standardized and expanded school lunch. It standardized and expanded food stamps. It led to improvements at FDA, consumer protections. It modernized the dietary guidelines process. It led to school breakfast. It led to WIC, the Women's, Infants, and Children's Program. None of those things existed before this conference. Well, it's been 50 years, and we have a very different set of problems. And so I think what I would recommend to the next administration is to have another White House conference on food, nutrition, and health, bring in all the stakeholders, from advocacy organizations to people representing the public, to folks working on equity, to business, to scientists, public health, and let's roll up our sleeves. There's win-win solutions here. It's win-win, right? This isn't like tobacco where it's a fight to the death and we're just trying to eliminate tobacco. We can make healthy food that's sustainable and affordable, and everyone will benefit. And so I think that this is really the future of our country, is to fix food.
Absolutely. What a great point. I also like that you said food as an opportunity. And because you work with so many young people who are starting their careers as nutritionists and diet policy leaders and real food system thinkers and doers, this is really one of the most exciting times to be involved in food, nutrition, and agriculture. So thank you for all the work that you do for people like me, much younger than me, who come through these programs at Tufts, because I think you're providing a great service. I want folks to be able to know how to get in touch with you. You can go to Twitter at @dmozaffarian. And the food site is nutrition.tufts.edu. And we will also have those links available on our website. Dari, you have taught me so much. Thank you for sharing your expertise today, and I'm really glad you could join us. I hope folks will join us for our next episode with Tony Hillary from Harlem Grown. Thank you so much, Dari. Please stay well.
No, thank you so much. Thanks, Danny.